So for the last few years, there's been interest in combining immune therapy with various targeted agents. I think this really stems from the fact that many patients who have oncogene-driven cancers, such as EGFR or ALK-rearranged lung cancers, they benefit from targeted therapies, but resistance develops at some point. And the other issue with them is that immune therapy doesn't tend to work well on its own. Those patients tend to be resistant to immune therapies. So there's been an effort to combine immune therapies with targeted therapies for those patients. And there's been various studies. I think there's been several issues, though, with many of these trials, and I think the main issue has been with toxicity. So several of the trials have shown that there can be fairly substantial toxicity when combining targeted agents with immune therapy. So probably the best example of that is a trial with osimertinib with durvalumab. And that trial showed really high rates of pneumonitis, and the trial was stopped early, or that arm of the trial was stopped early. And there's been other examples as well for ALK patients. Combining immune therapy with targeted therapy can cause elevated LFTs and other toxicity. So I think there's a lot of caution in this area, and as far as I know, there's no new trials being developed because of this toxicity for those patients. I think the other issue is that it's not clearly beneficial to combine them. I think we haven't seen a strong signal for the efficacy standpoint as of yet.